Hi, my name is Danielle Bordeaux. I'm a physical therapist at Michigan Medicine, and I'm here talking with you today to start you with some exercises, hopefully to speed up your recovery in this journey until we can see each other face to face. So first, I wanted to talk to you guys today about how hard these exercises should be completed and how you should feel when you're doing them. In therapy, we use a scale of rating of perceived exertion to tell us how hard we're working. I'm going to show you a picture. This scale is a 0 to 10 scale, with 1 being very light activity, 2 to 3 is light activity, 4 to 5 moderate activity, 6 to 7 vigorous activity, 8 and 9 is very hard activity, and 10 would be maximal effort. So for all of these exercises that we're going to ask you to do, we're going to have you work in this green zone, about a 4 to a 5, which is moderate activity. On the sheet, it also says that you should feel that you can exercise for a long period of time and be able to talk and hold short conversations. So that just gives you an idea of how hard and the intensity that these exercises should be. Nothing should be increasing your shortness of breath, making you feel pain, or increased fatigue. For this exercise, we're going to do diaphragmatic breathing. We talked about it in sitting, but you can do it in this position as well. Your hands will be placed on your stomach. Again, the diaphragm is a muscle that controls your breathing at the base of your lungs. So what you'll do is put your hands on your stomach. You're going to take a gentle breath in, letting your stomach rise, holding for a second or two, and then blowing out slowly. One more time, breathe in, belly rises, hold, and blow out slowly. So for this exercise, we're going to do the chest stretch. It's called the butterfly stretch. What you'll do is you'll place both hands behind your head. They don't have to be interlacing, but they can if you're able. Elbows are going to start out pointing towards the ceiling, and then you're going to open them up slightly, pointing towards the side. This is the position that you will hold for about 30 seconds. You will feel a gentle stretch across your chest in this area. And then bring back up to the center and out to the side. Hold for another 30 seconds. So for this next exercise, it's called heel slides. What you'll start is with both knees bent, like you see mine, and one leg is going to straighten all the way out down to the table. And then it's going to come back up to its starting point. Your heel should float along the table. It does not have to make contact with the table, but it's okay if it does, like so. All variations are okay. The goal is 20 times per leg. Do what you feel you can do. So for this next exercise, it's called bridges. Again, you'll start with your feet bent, like your knees bent like mine are. Arms just down at your side. And you're going to be lifting your hips and pelvis up towards the ceiling and down. You'll do this slowly, pausing with a brief hold at the top and back down. If you can't go up all the way, that's okay. The main thing is that when you do this, you're squeezing your bottom muscles. Also good to keep in mind is keeping your belly tight while you're doing this so that your back is flat. 20 times is the goal. For this next exercise, you're going to take a roll-up towel or folded over pillow and place it between your knees. Arms down at your side, and you're going to gently squeeze your knees together. Hold for a few seconds and relax. Long enough to say the word squeeze and relax. Again, the goal is 20 times for this exercise. So next we're going to cover a log rolling technique. All that is just rolling over onto your side in bed. It's very important to change positions frequently when you're recovering. So so that your body uses all of its muscles that it may not be using as regularly as it used to. So for this, you're gonna roll your body all in one motion over to the side. Knees should be pointing towards the front now and resting comfortably. So for this exercise, you're going to utilize that log rolling technique to get onto your side. And you're going to be in this position with your knees slightly bent and your feet are together. You're going to open the top leg like this. We call this exercise clam shells because your legs look like a clamshell opening. If you can't lift as high as I am, that's okay. Do what you can. The goal is 20 times. So we're gonna go over how to get up sitting on the edge of your bed. A lot of people try to sit straight up doing a sit-up, and that's technically not the right way. That kind of looks like this. We wouldn't like that technique. So what we're gonna do is roll gently onto your side using that log rolling technique that we talked about earlier. Knees together. Once you're in this position here, we're going to slowly bring your feet to the edge of the table. Your elbow here is going to get close to your body so that you can push with it. And then put your hand down and sit up the rest of the way.